This chewable tablet is used to relieve symptoms of excessive stomach acid, such as stomach upset, heartburn, and acid indigestion. The combination of aluminum and magnesium in this medication helps to quickly lower the acid in the stomach. It works on existing acid in the stomach and does not prevent acid production. You can take it alone or with other medications that lower acid production, such as cimetidine, ranitidine, or omeprazole. It's best to take this medication as directed by your doctor, usually after meals and at bedtime. Remember, liquid antacids usually work faster than tablets or capsules. When taking this medication, it's best to do so after a meal or at bedtime as needed. Make sure to follow the directions on the product package or as directed by your doctor. If you have any questions, don't hesitate to ask your doctor or pharmacist. If you're using the chewable tablets, be sure to chew thoroughly before swallowing, and then drink a full glass of water. And if you're using the liquid form, make sure to shake the bottle well before pouring each dose. It's also recommended to refrigerate the suspension to improve the flavor, but do not freeze it. The liquid form works best if taken without other fluids, but you can mix your dose with a little water if needed. It's important to note that this product may react with other medications, preventing them from being fully absorbed by your body. So, it's crucial to talk with your doctor or pharmacist about how to schedule your medications to prevent this problem. If your acid problems persist or worsen after using this product for 1 week, or if you think you have a serious medical problem, seek medical help right away. And if you're using this medication regularly on a daily basis for more than 2 weeks, it's important to ask your doctor whether this is the right medication for you. Some common side effects of this medication include nausea, constipation, diarrhea, or headache. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. The magnesium in this product can cause diarrhea, while the aluminum can cause constipation. To help control diarrhea, you can use an antacid that contains only aluminum along with this product. To minimize constipation, it's recommended to drink plenty of fluids and exercise. Diarrhea is more common with this product than constipation. If your doctor has prescribed this medication, it's because they have determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. It's important to be aware that aluminum-containing antacids can bind to phosphate in the gut, leading to low phosphate levels, especially with long-term use. If you experience symptoms of low phosphate, such as loss of appetite, unusual tiredness, or muscle weakness, it's crucial to inform your doctor. If you experience any serious side effects, such as dizziness, fainting, slow/shallow breathing, or mental/mood changes, it's important to seek medical help immediately. While a serious allergic reaction to this drug is rare, it's important to seek medical help right away if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. In the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using this medication, it's important to let your doctor or pharmacist know if you have any allergies to aluminum hydroxide, magnesium, or any other allergies. This product may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your pharmacist for more details. If you have health problems such as frequent alcohol use, dehydration/fluid restriction, or kidney problems, it's important to consult your doctor or pharmacist before using this product. It's important to note that this medication may contain aspartame, so if you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, or phenylalanine, it's important to consult your doctor or pharmacist about using this drug safely. For pregnant individuals, this medication should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. Additionally, this medication may pass into breast milk, so it's important to consult your doctor before breastfeeding. Remember, it's important to be aware of any potential drug interactions with Hyd-Mg Tr-Alg Ac-Sod Bicarb 80 mg to 14.2 mg chewable tablet. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. There are some products that may interact with this drug, such as phosphate supplements and sodium polystyrene sulfonate. Also, antacids can interfere with the absorption of many other drugs, so be sure to check with your pharmacist before taking antacids with any other medication. Always consult with your healthcare professional before making any changes to your medication routine. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or contacting a poison control center. In the US, you can reach your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center for assistance. Make sure to keep all of your medical and lab appointments. In addition to taking this medication, lifestyle changes like stress reduction programs, quitting smoking, limiting alcohol, and making changes to your diet, such as avoiding caffeine, fatty foods, and certain spices, can help make this medication more effective. Talk to your doctor or pharmacist about lifestyle changes that might be beneficial for you. If you are using this medication regularly and forget a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one as usual. Don't take a double dose to make up for the missed one. Make sure to store this medication at room temperature, away from light and moisture. Avoid freezing and do not store it in the bathroom. Keep it out of reach of children and pets. When you no longer need this product or it has expired, make sure to dispose of it properly. Do not flush it down the toilet or pour it into a drain unless instructed to do so. It's best to consult your pharmacist or local waste disposal company for guidance on the proper disposal of this medication. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.